The broadcast is now starting. All attendees are in listen-only mode.
Okay. All right. Good afternoon, everyone. Hello and welcome to the Dallas County Health and Human Services webinar series. I'm your host, Marisa Gonzalez, Public Information Officer. We have another great webinar to share with you today. In recognition of 2019 World TB Day this Sunday, March the 24th, we're going to discuss one of the world's most deadliest diseases, tuberculosis. World TB Day is a day to educate the public about the impact of TB around the world and in our backyard. This year's 2019 World TB Day theme is It's Time, because it's time to end TB. I'd also like to inform you that this webinar is being recorded live, so if you want to share this presentation with others, it will be posted on the Dallas County Health and Human Services website next week. Our website address is www.dallascounty.org/HHS. Also, if you haven't already, follow us on Twitter at DCHHS and Facebook or Dallas County Health and Human Services to stay abreast on the latest public health updates. Just a few house rules before we begin. Please put your phones on mute to avoid any background noise. Again, this is a live webinar and it is being recorded. If you have any questions that you would like to ask any of our presenters today, please type them in on the right-hand side of your screen. There's a little text box, and we will answer your questions towards the end of the webinar. We have three great presenters for you this afternoon during this webinar. Our first presenter is Ms. Tanisha McCarroll. Ms. McCarroll is a TB health educator at Dallas County Health and Human Services, and she will explain what TB is, how it's transmitted, signs and symptoms, as well as testing. After Ms. McCarroll, we will have Dr. Julie Martellini. Dr. Martellini is the epidemiology program planner for Dallas County Health and Human Services. She will deliver the TB surveillance overview. And our third presenter will be Dr. Gary Wu, Assistant Director of the TB Clinic at Dallas County Health and Human Services. Dr. Wu will explain TB infection as well as TB disease. And now it is my honor to introduce you to Tanisha McCarroll. Ms. McCarroll?
Thank you, Marissa. As she said, we're going to discuss tuberculosis for the general public. Tuberculosis, also called TB, is a condition caused by the bacterium, Mycobacterium tuberculosis. The bacteria is spread through the air like the flu when a person with contagious TB coughs, sneezes, shouts, or sings. When someone inhales these bacteria and they reach deep into the lung, this TB infection occurs. TB infection is also called LTBI or latent TB infection. Okay, so now we're going to go and discuss infection or disease. Once the bacteria is deep in the lungs, the body's defense system surrounds the bacteria and form a wall that keeps the bacteria under control. This is TB infection. If the body's defense system weakens and cannot keep the bacteria under control, the bacteria starts to multiply, break down the wall, and cause disease. This is TB disease. As it's indicated on the lungs, we're going to show what latent TB might be and active TB disease is. Latent TB, also LTBI, lives but does not grow in the body. That person usually is not sick or have symptoms. That person cannot spread from person to person, the germ, can advance to TB disease. TB disease is active and it grows in the body. It multiplies. It makes that person feel sick and have symptoms. That person can spread the bacteria from person to person. It can cause death if not treated. TB infection has a small amount of TB bacteria in his or her body that are alive but inactive. That germ is sleeping, it's dormant. They cannot spread TB bacteria to others. That person, like I said, usually doesn't feel sick, but may become sick if the bacteria becomes active in his or her body. Usually that person has had a TB skin test or a TB blood test reaction indicating TB infection, a radiograph which is typically normal, sputum, smears, and cultures that are negative, should be considered treatment. This person should consider treatment for LTBI to prevent TB disease in the future. Does not require respiratory isolation, not a TB case. A person with active TB disease is contagious. This person has a large amount of active TB bacteria in his or her body. This person may spread the bacteria to others. This person may feel sick, have symptoms such as cough, fever, and or weight loss. Usually this person has had a skin test or a TB blood reaction indicating TB infection. Their radiograph may be abnormal. Their sputum, smears, and culture may be positive. This person needs treatment for TB disease. This person also may require respiratory isolation and is considered a TB case. Now we're going to talk about the testing methods for TB infection. There are two kinds of TB tests for TB infection. We have a TB skin test, which is usually called a TST, or a blood test. These tests are considered equal. A positive test only means you're likely to have TB infection. No test is perfect, but because there can be some false positive or false negative tests. A TB skin or blood test alone does not determine if a person has TB disease. It is only the first part of a comprehensive medical evaluation. We're going to go over the signs and symptoms for tuberculosis. Usually a person that has TB in the lungs cough lasts 3 weeks or more. They have chest pains. When they have that cough, they might be coughing up phlegm or blood. That person might lose appetite, have a loss of appetite, unexplained weight loss, night sweats, waking up in a drenching wet, fever or fatigue. A person that has TB outside of the lungs might have blood in their urine, back pain, headache, confusion, loss of appetite, unexplained weight loss, night sweats as well, fever, and fatigue. Come by and see us. We're located at the 3rd floor on the Dallas County Health and Human Service Building at 2377 North Stemmons Freeway, Dallas, Texas. I've posted our clinic hours. Our telephone number is 214-819-2071. Our skin tests are $30. Our blood tests are $50. And usually you have to have a referral for a comprehensive TB evaluation, which includes a chest x-ray, which the fee is $80. Medicaid is accepted, but you will not be turned away for financial reasons. Thank y'all. Have a great day.
Thank you, Ms. McCarroll. And now I would like to introduce Dr. Julie Martellini. Dr. Martellini is going to discuss tuberculosis in Dallas County and talk about the surveillance overview. Dr. Martellini?
Thank you, Marissa, and thank you very much for your time and attention. So as she said, I will be going over TB surveillance, and we're going to start with worldwide surveillance of TB. Now, TB is an ancient disease. It's been around for a very long time, but it is still, as Marissa said previously, one of the world's deadliest diseases. It has actually infected about 1/4 of the world's population. Which you break that down, that's about 2 billion people. That's billion with a B. In 2017, 10 million people around the world became sick with the active TB disease, and there were unfortunately 1.3 million TB-related deaths worldwide. Now, there are about 22 high-burden countries, according to the CDC, and these countries have endemic populations that are infected with TB. It can be 40, 50, or more % of their population that may have a latent TB infection or TB disease. And TB is a leading killer of people who are infected with HIV. Now, TB is a problem in the United States as well. In 2017, there were over 9,000 TB cases reported in the U.S. Now, these are the 2017 numbers because usually the 2018 data is not released into the summer, so you're going to see data from 2017 throughout the presentation. There were 528 TB deaths in the United States in 2016. A typical TB case will require 180 days of medication plus the X-rays, lab tests, and the full comprehensive medical exam. So this can represent quite a bit of money and cost. With the spread and persistence of TB, it becomes more and more costly. In 2017, the U.S. alone spent $463 million on treating TB. Now, our current strategies are not quite enough to achieve TB elimination in this century, but the CDC has released new strategies for us to use, including treating latent TB infection so that it will not progress into active and infectious disease, as well as new medications for treating latent TB infection. Now, it's not all bad news. TB cases are decreasing in the U.S. overall. You can see the trend going back all the way to 1993 on this chart. In 2017, there was a decrease from the number of cases reported in 2016, as well as the lowest case count on record in the United States. So strategies are working and progress is being made, but with new strategies, it will help us achieve that goal faster. Now, you can see a map from the CDC of the states and territories in the United States that are above the TB incidence rate, which is the average for the U.S. Now, TB incident rate just means that's the number of TB cases, active TB disease, per 100,000 residents. So the average for the United States is 2.8 TB cases per 100,000. And the territories and states you see in blue are actually above that national average. And for Texas, as well as 10 other states, the District of Columbia and New York City, those territories actually represent about 60% of the national total of TB cases. Now, Texas, we actually have a case rate, an incidence rate of about 40% higher than the U.S. average. The Texas TB incidence rate is 4.0. And remember, the average for the nation is 2.8. You can actually see the map of Texas here and some of our territories that have the highest TB incidence. And there, Dallas County is second only to Harris County with our TB case load. Now, this can factor in, based on our population. We do have high incidence of diabetes. We have a higher incidence of immigration, as well as a decrease in access to health care for people, especially our high-risk populations, and then a higher incidence of low socioeconomic status, all of which help a higher TB transmission and incidence rate. Now here you see our Dallas County HHS annual TB summary. Our epidemiology team does a wonderful job releasing this, and you can actually see this on our website now. I have that listed below. And I'm going to go over the data we have here. Now, for Dallas County TB cases, they have also followed the trend and have decreased significantly. The number of annual TB cases has decreased, in fact, by 45% from 1993 in Dallas County. The case rate of Dallas County in 2017 was more than twice the national average, or about 50% more, where you can see we're about 6.0 incidence rate, and the Texas rate is about 4.0. But, when we have, a highly populated metropolitan area, we have higher incidence of homelessness and, we have a higher risk population. Now for 2018, the trend does continue though. We had 155 TB cases reported for us in Dallas County in 2018, so it does continue to decrease. The trends in our cases do kind of follow the national trend as well. Our populations at risk are the urban populations, the low socioeconomic status populations, and actually the more minority race and ethnic groups make up the vast majority of our cases in Dallas County. It's about 94%, as well as about a little over 54% of our cases being in foreign-born population. We see the trend of men having a significantly higher rate of TB infection here in Dallas County. Here on the left graph, you can actually see when we get to age 65 and older, the incidence in men is actually over double that than we see in females. And on the pie chart on the right, you can see the incidence based on age groups. And our biggest age group, our most prevalent TB case age group, is age 19 to 44, which we identify mainly as the working males in our population. Here, the TB cases are disproportionately found in minority and foreign-born populations. But again, we do see this nationally. This is a national trend. We have about a case rate of about 33 times higher for our Asian populations in the U.S., 9 times higher for African Americans, and 8 times higher for Hispanics and Latinos, with about 7 out of every 10 TB cases being among our foreign-born population. So we see our groups with the high latent TB infection rates are commonly our immigrant population, international adoptees, refugees from, as well as travelers to the high prevalence areas. As I mentioned, there are high burden countries where if you visit, you may be exposed to tuberculosis. Now, these are very important trends to follow because these help us focus our efforts on the high risk populations and help battle TB that much more efficiently. Now, the majority of TB cases in Dallas County, as I said, are in our minority and foreign-born populations. The proportion of U.S.-born cases has steadily decreased in the last 2 decades. We've seen about 45% of TB cases in 2017 were the U.S.-born. Asians continue to have the highest incident rate of TB in Dallas, with approximately 2 to 4 times greater than rates in other minority groups. And here you can see the breakdown on our right. The pie chart shows you the TB cases by our race and ethnicity, with our Black population representing about 41% of TB cases in Dallas County, Hispanic representing about 31%, and then Asian about 21%. And then here you can see over time the trend. We are seeing the decreases in TB cases with most groups, except we see that high fluctuation rate in that Asian population. That's that little red dotted line you can see on the graph. Now, certain risk factors can accelerate and or enhance TB disease, and we're going to go over some of these. We do see significant numbers for in Dallas County. Here you can see in 2017, about 17% of our TB cases did have the risk factor of alcohol use. 8% also had diabetes when they got their TB diagnosis. We had 1% with injection drug use, and then 13% with non-injection drug use. Now, the proportion of TB cases occurring in persons experiencing homelessness has decreased when compared to the last 2 years, but here in 2017, we still had about 10% of our TB cases that were also experiencing homelessness at the time. HIV and TB are a very deadly combination, as I mentioned previously. Tuberculosis is a serious health threat, especially for people living with HIV who may have a compromised immune system. And they are more likely than others to become sick and advance into TB disease. Worldwide, TB is one of the leading causes of death among people living with HIV, so this is why it's very important when getting that TB diagnosis to make sure the patients also get that HIV test. And here you can see in the graph on the right in 2017, about 11% of our TB cases were also HIV positive. Now, drug resistance in TB is much harder and more expensive to treat. And here you have a little bit of a breakdown with TB drug-resistant strains and how complex and costly they can be. These are the 2017 cases. There were 2 in the U.S. that were extensively drug-resistant TB. That is the most expensive form of TB to treat. There were 121 cases of multi-drug resistant TB, and then just under 9,000 of the normal non-drug resistant tuberculosis. In 2017, 8 people in Texas were infected with a multi-drug resistant tuberculosis. However, we were lucky that there are no cases of the extensively drug-resistant TB, though that is still tested for in our clinic. In Dallas County, we did have 1 case of the multi-drug resistant TB. You can see that on the bottom graph. So we do have the tools and knowledge to eliminate TB worldwide. Ending TB requires maintaining and strengthening current TB control priorities while increasing efforts to identify and treat latent TB infection among our high-risk populations, which this data helps us kind of focus on those and figure out which ones are the highest risk. So eliminating TB requires a comprehensive approach of our vigilant surveillance, the better diagnostic and treatment, as well as testing and treatment of high-risk populations. All right, so thank you very much for your time.
Thank you very much, Dr. Martellini. And now I'm going to introduce you to Dr. Gary Wu. Dr. Wu is going to talk about tuberculosis, disease, and infection. Dr. Wu?
Thank you, Ms. Gonzalez. I appreciate the opportunity to speak concerning tuberculosis. Today, I'd like to talk about, again, 2 different types of tuberculosis or 2 different stages. Maybe understand latent tuberculosis and understand tuberculous disease. I'd also like to talk about tuberculosis in Texas, the disease in Dallas County, and how we apply the principles, surveillance that we've discussed to two particularly important populations. What is tuberculosis? Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis. The disease usually affects the lungs, but can affect any organ in the body, including the lymphatic system, kidney, and brain. It's almost always curable with antibiotics that are readily available in the United States. It is spread through the air from one person to another. This occurs when someone coughs, sneezes, sings, and the source case will aerosolize the organism or place the organism in the air, and the contact will breathe in the infected air. And exposure does not always cause infection. What occurs is the infection can progress into disease when the TB bacteria becomes active and grows. If your immune system can contain the infection, then you have latent disease. However, if your immune system is weak in, for example, HIV, diabetes, or you have poor nutrition, you progress to the active disease. Risk factors for TB infection are spending more time with an infectious case. If you spend more time with an infectious case, you have a higher risk of developing the infection. It's not possible to get tuberculosis from sharing a glass or touching a doorknob. It's spread through airborne infection. The probability of TB infection or transmission is affected by multiple factors. Number one is the susceptibility of the exposed person, the infectiousness of the person with tuberculosis. For example, how much tuberculosis they have in their lungs or how extensive is the disease in their lungs. Environmental factors can affect the concentration of tuberculosis organism. Were you infected in a small enclosed area versus being outside? Again, the proximity, frequency, and duration of exposure are factors in the transmission of tuberculosis. Again, living in overcrowded conditions increases the probability of TB transmission. So does poor ventilation and repeated exposure to the TB germ. These are risk factors for TB infection: being a close contact to a TB case, being immigrating from a country that has a high incidence of tuberculosis, residents and employees of high-risk congregate settings, healthcare workers who serve high-risk clients, and being part of a population that is at high risk for infection or disease, such as the medically underserved, individuals low socioeconomic status, or those who have issues with alcohol or drugs. Children and adolescents exposed to adults who are cases are also at high risk. The TB pathogenesis is another way to explain it would be, how does TB work? How does it infect you? How does it make you sick? And what occurs is a small number of TB bacteria enter your bloodstream and spread throughout your body. And the bacteria may reach any part of your body, but there are areas where it tends to predominate. For example, your lung, lymph nodes, and at times brain and blood. We're fortunate that once a person with tuberculous disease is on medication, they soon become non-infectious. This occurs several weeks after taking the medication. People on medication can resume their normal lives without spreading the disease to other people. Certainly, testing, evaluating, treating TB infection is how we propose to eliminate tuberculosis in our community. This is a slide that talks about the differences between latent tuberculosis or TB infection and active disease. And certainly, I think it's well worth going through this one again. If you have latent tuberculosis, you usually have no symptoms. You have a positive skin test or blood test. You have a normal chest x-ray, and you're not contagious, and that's usually treated with one drug. If you have the disease, you usually have symptoms that are greater than 2 weeks, consisting of cough, fever, weight loss. You may or may not have a positive skin test or blood test. Your chest x-ray is abnormal in cases of pulmonary tuberculosis, and you are contagious and you require multiple medications for a long period of time. The slide on the left shows a chest x-ray, and the arrows are pointing to a cavity in the lung. Tuberculosis causes disease or cavities in people who have the disease. On the right side is a laboratory stain that shows the tuberculosis organism, and it's called a Kenyan red stain, and the red lines are the tuberculosis organism. So what occurs is sputum is collected, it's sent to our laboratory, and the laboratory will stain the patient's sputum to look for the tuberculosis organism. There were 1,100 cases of tuberculosis cases in Texas during 2017. This is the second largest caseload in the United States, with an incidence of 4 per 100,000. This is 40% higher than the 2.8 per 100,000 in the general United States. This is in Texas. Dallas County has the second highest number of tuberculosis cases. The first is Harris County. Refugees are prone to both TB infection and disease. In 2017, the largest number of refugees came from the Congo. The second most frequent group was Iraq, and the third was Syria. So again, we make special effort to screen refugees for tuberculosis infection and disease, and also to provide therapy for disease and infection. When we screen a refugee population, we ask them for symptoms of cough, fever, weight loss, or if they've coughed up blood. whether they've had a previous history or therapy for tuberculosis, have they worked or have they ever had anyone in their household who was a tuberculosis case, do they have a history of diabetes or taking drugs that may suppress their immune system? If you have diabetes or you have a history of being immunosuppressed, you have a higher incidence of moving from latent to active disease. We also perform physical exams consisting of PPD skin tests or blood tests for looking for PPD skin tests or blood tests looking for TB infection, chest X-ray and sputum collection for people who we suspect of having tuberculosis infection or disease. And of course, we provide diagnosis and therapy as appropriate. Second population that we look at are the homeless individuals or people experiencing homelessness. We've had success. In fact, the percentage of tuberculosis cases among the homeless has decreased from 18% to 8% in 2017. Individuals experiencing homelessness have multiple TB risk factors consisting of poor nutrition, substance abuse. They may have had a history of confinement, and they may also have a history of psychiatric disorder. The definition of a chronically homeless person: this is an unaccompanied individual with a disabling condition who has been homeless for a year or more. We find the incidence of tuberculosis among the chronically homeless especially problematic. Frequently, chronically homeless individuals have disabling conditions consisting of substance abuse, a mental disorder, developmental disabilities, or chronic physical illness or disability. Again, we screen this population and ask for symptoms of cough, fever, weight loss. We ask them if they have a past medical history consisting of, have you ever been in contact to someone who was a TB case? Do you have diabetes? Do you take any drugs that would cause your body to be immunosuppressed? We also look at their nutritional status, ask them about their psychiatric history, whether they've ever had a history of being confined in a correctional facility. The physical exam would also include a blood test or a PPD skin test looking for latent disease, chest X-ray and sputum collection in situations where we're concerned about the active disease. And we come up with a diagnosis of latent versus active disease. We also provide appropriate therapy. These are some of the facilities that we provide tuberculosis screening at: the Bridge, Union Gospel, Austin Street, Dallas Life, and Our Calling. And these facilities have a special mission with the homeless. We also provide directly observed therapy, where medication is given by trained staff to TB patients. And we also follow the national guidelines for tuberculosis control in homeless shelters. That concludes our discussion for the day. I open up the discussion for questions. Thank you for your time and your attention.
Thank you, Dr. Wu. Now we're going to open it up to any questions that you may have regarding tuberculosis. We will look at the questions here. Can you please send the PowerPoint slides? Yes, we will have them available on our website next week. So look out for those. They will be in the TB portion of our website at www.dallascounty.org. And yes, they will be available to share. Okay, so we're going to go on to our next question. And the next question is, what should I do if I've spent time with someone with TB infection? I'm going to give that one to Dr. Wu.
As we discussed, an individual with TB infection cannot spread the germ to other people. You do not need to be tested if you have spent time with someone who has TB infection. However, on the opposite side, if you spend time with someone who has TB disease, then you should contact your healthcare provider or pay a visit to us here at Dallas County Health and Human Services.
Thank you. Let me go on to the next question. Okay. What if someone has received the BCG vaccine, which is given in many countries? So I'll give that question to Dr. Wu.
There are two tests to evaluate for latent tuberculosis infection. The first test is the PPD skin test, which can be affected by the BCG vaccination. The second test, the blood test, is not affected by the BCG vaccination, and that test would consist of currently the quantiferon gold and the T-spot test. So we have both tests available, and before testing, we would ask individuals if they have a history of BCG infection or if they immigrated from a country that routinely provides BCG infection to prevent pediatric TB meningitis.
Thank you, Dr. Wu. And we've got the last question here. How many people in Texas have TB? I'm going to give that one to Dr. Martellini. How many people in Texas have TB?
Okay, well, we know as of 2017, there were 1,127 cases of TB disease. Now, as far as how many people have latent TB infection, we can only estimate that because that's what we're actively trying to find out. So, unfortunately, I don't have an exact number to give you for TB infection.
Thank you, Dr. Martellini. Looks like those are all the questions. And this will conclude our webinar today. I'd like to personally thank all of the presenters today for the webinar and everyone who participated with us today. If you think of any questions later on, you can always email us at PIO, and that's Peter, I-O _ D as in dog, CHHS at dallascounty.org, and we will get those answers for you. Again, we want to thank everyone for their time and attention this afternoon, and thank you for listening to our Dallas County Health and Human Services TB Disease and Prevention webinar. Thank you.